guys, welcome to the Trial Site News Podcast. I'm Dr. Erin Stair, your host, and today we'll be chatting with Paul Johnson. We're going to be talking about vaccine mandates for public universities and what is allowed, what isn't allowed. So Paul, thank you so much for joining us.
Thank you for having me.
Yeah, so first, do you mind telling us a little bit about you and what you do now?
Sure. I am the CEO of Redirect Health. We're a national healthcare company. We're medically licensed in all 50 states. We basically provide healthcare for businesses to help assist both in lowering their costs, giving their customers or their employees not only a better outcome, but a better experience in healthcare.
So before we start talking about the recent ruling involving Indiana University, what are the current rules or laws that allow for public universities to mandate vaccines?
Well, I would start by telling you probably should try to define what does mandate mean. The question is, can you mandate it at the federal level? Can you mandate it within a university? Can you mandate it within local government? Oftentimes people will hear mandate and they will assume that that means that literally they're going to tie you down and force you to take a shot. That's not going to happen anywhere in the United States. No one is going to be forced to take a vaccine. I just would be very surprised to find that that happens. The real question legally is whether or not you can tie activities to vaccinations. And there's a huge body of law on that. There have been lots of precedents. It's been through the courts in a variety of different ways over a number of different years. And local governments, free enterprise, private businesses, universities, they can tie activities to whether or not you would take a vaccine. So as an example, a university could say, hey, if you want to attend classes in our school, you would need to be vaccinated. Now, I'm not going to say whether that's the appropriate cause of action or not. I would just say that I think two things are important. First, understanding what mandating means, because a lot of times people can become intimidated or afraid that there's going to be some Gestapo type police department or other militant group that's going to force you to take a vaccine. I don't believe that will happen in the US. But can institutions, universities, and other groups require that as a quid pro quo for being able to take their classes to keep all of their students safe, a requirement that you be vaccinated? Again, there's a large body of law on that says yes. Now that can become more confusing if a state takes the opposite point of view. And in my guess, if a state takes the opposite point of view, meaning you cannot mandate it, there will end up being a number of different court decisions that will have to decide, is it federal law, is it precedent, or is it state law that will end up taking priority?
Interesting, thank you. That's such a good point, clarifying what mandate means. And that word does scare a lot of people and turn a lot of people off who really value having that choice. So I wanted to jump into the ruling involving Indiana University. As I understand it, 8 students, I think, first Indiana University said you need to have the COVID-19 vaccine, students and employees, when you come back in the fall. And 8 students, I guess, filed a lawsuit saying this violates 14th Amendment, our constitutional rights. And then I think I just read that an appeals court sided with the University of, Indiana University. So where does that go from there? Will that go higher up in the courts? And what does that tell other public universities?
Well, I would guess, by the way, I'm not a lawyer. I was mayor of the city of Phoenix. I spent a lot of time in politics. I spent time making law, and I've also spent a lot of time litigating on legal points, but always either as the defendant or the plaintiff, not necessarily as the lawyer. I think the answer is you'll see more institutions that will be doing the same thing. More institutions will begin to take the position that to attend classes at their school that you have to have a vaccine. In terms of where that case may go, I suspect it'll be appealed to the Supreme Court. And then the question is whether or not the court will pick it up. I've spoken to a lot of experts on this, both for our own business and trying to understand what local governments may do or what maybe they should do. For the most part, it's not unanimous, but overwhelmingly the majority of legal scholars that I've spoken to all believe the body of law is quite large on institutions having the rights to make those types of decisions, specifically with vaccines.
I wanted to ask you, and you kind of touched on this earlier, and I think it's interesting because you were a mayor of a city. So, with all the stuff going on, in terms of what sort of rules you can make and you can't make, the state government cannot mandate vaccines, but public universities can. Is that correct?
Well, I think states could create mandates. As an example, let me give you a mandate I think that they could create if they wanted to, that any contractors or any individuals working for their state government who are being employed by them or being paid by them could be required to be vaccinated to be able to utilize to get a driver's license, to actually come into the building and fill out the application, that anyone coming in could be required to do it. I'm not saying, again, they should. I'm just saying I think that the state would have that right to be able to do so. The real question, at least as far as I'm concerned, I would tell you two things. I will give you my own personal opinion. Again, it's not right. It's just how I see it. The best place to make these decisions really isn't at the federal level or at the state level. The more local the decision is, the better off it is. If Joe Biden or Donald Trump came out and said that we were going to have a mandate, you can just expect that 50% of the population is not going to like it. It's just that simple. People recognize that what politicians do is that their currency is votes, and what they want to do is get reelected. So they don't necessarily trust them on their healthcare issues. It also is a very difficult place to have a conversation that doesn't immediately become partisan. Unfortunately, everything seems to be becoming partisan in this country. It's now about, are you red, are you blue, are you a Trumper, are you a Biden person, are you a Republican or a Democrat? And that's being perpetuated by the news medias, that's being perpetuated by the political parties, and oftentimes by candidates themselves. The more local the decision, the less of that you have. So a university, I would say, is local, but I would tell you what's even more local. Your doctor, your primary care provider. That to me is a really good place for you to get information on whether or not you should have a vaccine. If you're dealing with your primary care provider, for the most part, they're not taking a look at what's in the best interest of society. And, we've had lots of people who we have been in contact with that have taken the vaccine, and lots of people who did not want to take the vaccine. Here's what I can tell you. It is not as simple as saying they're a vaxxer or an anti-vaxxer, or they're a Trump person or they're a non-Trump person. There are valid reasons why some people do not want to take the vaccine. And I can tell you what the biggest one is: fear. They're afraid of the long-term effects that it may have on them, whether or not it's still too new. Sometimes they're concerned about the involvement of the political process in creating it. And certainly they're concerned about their children. Well, how are you going to best convince them to do it? By a politician telling them that they're mandated to do it? I doubt it. I doubt that that's going to have the effect that we would want. The best place to get information is from your primary care provider. It's from the person who won't be looking out after society's best interest. They're looking out after your best interest. Now, again, we've met with lots of people, and to me, the evidence is very clear. Your chance of dying or ending up in a hospital is dramatically lower if you take the vaccine. And that's the recommendation that we give to our patients. But again, when we see our patients and someone hasn't taken the vaccine, the number one thing that we're concerned about is them. It's their health. It's not what party they are in, or it's not what beliefs they may be following. It's just trying to make certain that their healthcare is being taken care of. So again, if you ask me, the more local these decisions are, the better. The question that you asked in the very beginning was, can the state create a mandate? I suspect if they wanted to create a broader mandate, they can. You're seeing in New York now decisions that are being made saying we're going to mandate it for people who would go into a restaurant. Can they do it? I suspect they can, and even if they can't, you may see some of them that attempt it, and then that may be litigated in the courts. And I understand why, from a state standpoint, they may want to do that. I'm just going to say that the better answer is to get people to deal with these issues more local. And again, the best place that I would recommend to anybody who's thinking about this, talk to your doctor. That's the place where you should be making that decision.
I appreciate that you talked about how it's not as simple, as anti-vaxxer or pro-vaxxer. They're very reductive terms. There are people who have a lot of concerns, and people should feel empowered making their health choices. And I think you're right. Like, that should be at the local level, and them getting information from the doctors that they trust. I wanted to ask you along the lines of mandates. Are there exemptions that go along with mandates?
Well, when you say that, what would you mean? Give me greater.
So somebody has, in the case of the COVID-19 vaccine, underlying health reason, perhaps, or religious reason.
Okay.
Yeah.
Yes. So in terms of exceptions, let me just start again why that's part of why I think that making these decisions from a legislative level is probably a mistake, because trying to figure out all the exceptions that can happen from a medical condition standpoint has to be very difficult. And the reason why I recommend people to talk to their doctors, we all come with special ailments, right? There are people who have heart conditions, there are people who are diabetics, there are people who have a variety of different diseases. And the best answer is going to be talking to a primary care physician or talking to a doctor who knows you and knows your specifics, and then can make the right recommendation for you. We've seen people who've come in that were pregnant and they wanted to know. It's a very good question. What is this going to do to my baby? Of course, that's a question that they should be asking. I've drafted lots of law, and what I can tell you in drafting law is that those exceptions become very, very difficult to figure out, to make certain that you get them all included, or to not, on the other hand, create a loophole that's so big that it doesn't matter anyway, that it's toothless. I think that it's a good idea for states and the federal government to create incentives. I think that what they've done by making the drug basically free and making people have access to it, those are very, very good things. I think getting out information is important, and getting out information on national airwaves and other places is important. But I think that this whole, I'm watching a lot of anger and angst being focused by both sides on the other. And sometimes more by the people who've been vaccinated, or the people who believe we should be vaccinated, on the people who haven't, saying that, that somehow or another they're doing something wrong by doing this. I just think that's the wrong approach. I think that the right approach is by trying to be empathetic about them, by trying to care about them, trying to make certain that we deal with all the specific issues that they may be dealing with, and trying to come to the right answer. And I think if we did more of that, try to love the people that we're trying to provide the care for, we'd find that it's a whole lot easier to fix this problem than the approach that we're taking now, where it just seems to somehow or another all be engaged in the national food fight that we call the American political system.
Yeah, it's so true. It's so divisive and tribal. I wanted to ask you in terms of mandating these vaccines, because they're not FDA approved yet. And a lot of people bring up this point, they're authorized for emergency use. Would that at all impact the legality of a public university mandating it, or anybody mandating these vaccines?
Oh, certainly any court would take a look at what is the public health purpose? What's the reason for doing this? And it's about the health, safety, and welfare of the general public, and whether or not what they're actually being given is something that can create other problems or could be damaging. And I'm certain anybody who's going to present evidence would present that. The idea, though, that an institution can say, and let's just use a restaurant, that a restaurant can say, hey, if you're not vaccinated, you can't use our restaurant. I believe that that's going to be found to be legal. If a restaurant made that decision, I think if the state government made it, it's going to be more difficult. It doesn't mean that it wouldn't stand up, but I think that it would be more difficult. I think if a university is saying, you can't take a class here without it, if I were giving them advice, I would tell them, well, why don't you allow them to keep taking the online course, the online version, and allow them to still be a part of the university. But the idea that the university is trying to protect their students or their faculty from catching COVID by making certain that people are vaccinated, it's probably going to withstand a legal challenge. Now, again, there are a variety of different nuances that can come up in that. And you've mentioned those, right? That is that, are these drugs actually doing what we hope they would do? And are there any side effects from doing that? A judge certainly could take a look at that and they could weigh it. What we saw in the case of Indiana is that the first judge who looked at it, which by the way was a federal judge appointed by Trump, said, no, the university had a right to do what they were doing.
Thanks so much for that, Paul. That was very informative. I'm sure our viewers will have a lot to think about. My final question to you, you are the CEO of Redirect Health. So can you tell us a little more about that? And maybe have you guys been busier than usual with the pandemic? And how do people find out more about that?
Sure. So let me do just a couple of things on that. The first one is one of the things, what I'd like to do is I'd like to tell you one of the things that we tell our patients, or at least that our providers will tell them. One of the clear issues when somebody comes in to get care and somebody is coming in to get the vaccine, they'll ask questions that are specific to them, and they'll ask about side effects that may exist and whether or not they should be afraid of it. What is becoming clear today is that increasingly there are more people asking those questions and more people in the last few weeks that are getting vaccines. My guess is the Delta variant has been a big part of that. If you look at the statistics, I'm just going to look through a couple of them here because I think they matter. Since June, literally every person who died of COVID in Maryland, and these are different state statistics because we really haven't compiled the statistics nationally yet in a great way, but we can get them very clearly from states. In Maryland, every person who died of COVID-19 was unvaccinated. If you look at new COVID cases in that state, it's between 95 and 93% respectively came from unvaccinated people. In Louisiana, 97% of the state's COVID cases and deaths since February have been unvaccinated people. Unvaccinated people in Louisiana were 20 times more likely to become infected with COVID-19, according to their state health department. In Alabama, the number is 96% of deaths since April 1st were unvaccinated people. In Los Angeles County, every COVID-19 case, hospitalization, and death was from unvaccinated people from July 12th, over 1,059 cases that were reported on that particular day, with 87% were under the age of 50. New York, we're seeing the same thing. The point is this: there is just no doubt that having the vaccine gives you a much better chance of staying out of a hospital, not getting sick, and not dying. Increasingly, more of the people being affected by this new variant are younger people. We believe that it's our job to try to tell people what's in their best personal interest to do that. And if they're not going to do it, to try to give them advice on how to handle the virus otherwise. Now, in terms of what Redirect Health does, again, we're medically licensed in all 50 states. We provide a service to employers to help them manage the healthcare for their employees. We employ somewhere around 200 providers in the local market. Many of them work through a telehealth system that we've created that helps us get that out to the rest of the country. I can tell you that the overwhelming majority of our patients and our members end up being people who the existing system really doesn't work for them. We have a very high amount of employees who are minorities, Hispanic, African American, and those end up being large unvaccinated populations. Again, not because their politics is right wing, but one, because oftentimes they have a more difficult time accessing the system, and two, because they don't have a friend who's a doctor or they're not engaged in that system, because oftentimes they're more afraid. Redirect's job, we feel, is to try to make certain that we inform them, that we give them access to the same medical system that most people have throughout the country. The traditional system works fine for a number of people, but there are somewhere around 25 to 30 million people who don't fit within access, and at the same time don't fit within the traditional, being able to afford the traditional healthcare system. If you look at the numbers, today about 50% of all employees make under $35,000 a year. Well, employers pay about $7,000 today for a premium, an annual premium per employee with a $6,000 deductible. So imagine they covered half of the premium, sent the other $3,500 to the employee. That employee has to pay $3,500 in a premium, and then they have to pay up to a $6,000 deductible before they get the first health care. For a $35,000 a year employee or under, that just doesn't make economic sense. Today, somewhere around 2/3 of all bankruptcies happen because of healthcare. And interestingly enough, about 70% of those folks had health insurance. It's the deductible that ends up bankrupting them. So in any event, that's the audience that we're focused on. And because we're focused on them and they're a population group that oftentimes is forgotten, the whole COVID issue has been a high priority.
Yeah, I think COVID has highlighted more so than ever how unaffordable healthcare can be for a lot of people in the United States. I want to thank you so much for coming on to Trial Site and sharing your perspective. I love to feature, as my viewers know, all different kinds of perspectives. So that was great. Thanks so much. And I want to wish you a lot of luck with Redirect Health. It sounds really interesting. And I'll definitely include a link below the podcast so you guys can check it out. So thank you.
Thank you.